AM Club. Welcome to MenoLabs Live and happy first day of spring. We're learning so much during this stage of life, but for some reason, many women don't realize the attention they need to pay to their pelvic floor. So today we're going to break down what you need to know to take care of your pelvic floor during perimenopause and menopause. Our guest today is so amazing, so get ready with your pen and paper and make sure to ask questions you have in the comment section below. It's going to be so good. As always, this session should not be considered medical advice and is being provided for information purposes only. It is not intended to substitute professional medical advice, diagnosis, or treatment. Please consult with your healthcare provider should you have any questions or concerns. I'm going to invite in our guests now. There's going to be a bit of a delay, so I'd love it if you'd share what stage of the the menopause journey you're in. And I'll start off. I am in perimenopause, so welcome everyone that I'm seeing joining us now. I'm going to invite in our guests now. And I don't see anybody sharing what stage they're in. Let us know. Let us know. I'm going to try again. Let's see. It's going a little slow. There. Oh, there she is. Welcome.
Hi.
Welcome. Happy Friday. My
Hey,
name
good to
is
see you.
nice to see you too. My name is Natasha and I'm the community manager for MenoLabs. And our guest today is Dr. Sara Reardon, who is a pelvic floor therapist and the founder of Vagina Whisperer, which I want to share with everyone. If you're not following her yet on socials, do it now. She's amazing. She has so much great content. But without any more said there, what are you drinking today?
I am drinking coffee with a lot of cream.
Ooh, yummy. And I have a matcha my husband just brought me, so I'm really loving it. I love my matchas. So let's get started. Welcome to all the people who are joining us. Dr. Sara, many people don't know what pelvic floors actually are. Can you share what body parts are included?
Your pelvic floor is a basket of muscles that sit at the bottom of your pelvis. I'm actually going to get my little model so that you all can see. And here, all of this red material that sits at the bottom of your pelvis is what we call your pelvic floor. And these are muscles that support your organs in the female body, your uterus and your ovaries, your bladder which holds urine, your rectum which holds poop. All of those rest inside of here. And this muscle also has three openings, one for the urethra where urine exits, the vaginal opening for menstruation, vaginal birth, and vaginal intercourse, and then the anal opening for bowel movement. So this muscle also helps with core support, movement, stability, breathing, sexual activity, menstrual health. So it's involved in our everyday lives and changes in every season of life as a woman. So we need to be aware of what it does, how to take care of it, and if we're having an issue, what we should do.
I love that visual. Thank you so much for sharing that with everyone. I remember watching Fried Green Tomatoes where they talked about looking at your vagina is what they said, but we know the correct term should be vulva, which many women still find hard to do. Do you encourage women to do this and why is it helpful?
I do encourage people to do it. And I kind of say this a little, with a little bit of kind of encouragement, but more people have seen this part of a woman's body than they've seen themselves. Their medical
Mm,
providers, their partners. And if
yes,
we don't know what our normal is, then we
that's
don't
so
know if
true.
something's unusual or abnormal, whether it's the skin tone and texture of the vulva, whether it looks irritated, sensitive, if there's swelling in the area. So
Mm,
it's really important, again, for us to know what the normal is
yeah.
and what's abnormal. What I see a lot during perimenopause and menopause is the certain parts of our vulva that are dependent on estrogen to stay healthy and plump start to kind of shrivel up and decrease. So the labia minora, the clitoral hood, these areas can get dry
Mm.
and sensitive. It can cause pain, itching, burning. But then the labia also start to shrink and what we call resorb. And you can literally see the labia kind of start to go away, almost like you're going in puberty in reverse. And
Interesting.
it's really important that if someone is like, am I in perimenopause? It's like, look at your vulva and your tissues will actually tell you how your body is changing.
It's kind of like getting a baseline. So we should start earlier
Yes.
on just to know what our body looked like I don't want to say originally, but when you were younger. And then as it
Yeah.
goes and you develop along, you need to know what's changing. I love
I would
that.
say you start early and you do it once a month, just like you were
Oh, once a
doing
month.
a monthly breast exam, right? Like we feel our breasts once a month to see, is anything changing? Do I feel a lump? You should be doing the same thing for your vulva. And it feels kind of weird.
Yeah.
There's also things to look for, like, does it look like anything's kind of falling out of the vaginal opening? Is there new tissue there? Is the tissue a different color? So there's a lot of information you can gather. But again, some of this is just kind of like rip the Band-Aid off a little bit, get
Yeah.
comfortable with
Get a
this
little
part of your
comfortable. Yeah.
body.
Issues with incontinence and diapers. Why is pelvic floor care important during perimenopause and menopause? I think you kind of highlighted some of those ideas, but
So specifically with incontinence, so this muscle supports your bladder. As your bladder fills, the muscles kind of tighten up to hold in urine. But with pelvic floor muscle weakness, which can happen with aging, high impact exercise,
Mhm.
postpartum, and menopausal changes, lower estrogen levels, your bladder just can't, your muscles can't hold in the bladder contents as well. And as you get older, your pelvic floor muscles lose 2% of their strength every year. So this isn't a situation that's going to get worse. It actually will kind of get progressively worse until over, 50% of women over the age of 65 leak urine. And it's one of the number one reasons for admission to a nursing home later in life. So I don't say that to scare people. I say
Yeah.
them because I really want them to understand the impact that not addressing these issues can have, that we need to do pelvic floor muscle training, which is not just Kegels. It's learning how to contract and relax those muscles, build strength there, just like we do everywhere else in our body.
So this is another kind of prompt for women to take care of their future selves. What you do now with your pelvic floor can affect what's happening later and
Yeah,
prevent
I
you
mean,
going and having to go to a nursing home because of that.
Yeah, I mean, and if you think about it, Natasha, it's this is something we're learning as women now when we talk about osteoporosis, like
Hmm.
vitamin D, calcium,
Yeah,
build your bone density so you don't fracture, fall, get osteoporosis,
so
heart
true.
health, do strength training and cardio so that you have a healthy heart. We also need to have healthy pelvic floors, but because
Hmm.
we're never taught about this part of our body, we don't know what to do. And that's what I really am so passionate about changing.
I love that. Thank you for sharing that. Why do women or people, because men can experience this too, experience leakage, and why isn't it just something that happens after having babies? Because a lot of people assume that maybe you're leaking
Yeah.
because you had a baby, but it's
Yeah.
not the case. It's definitely affects more people.
Totally. So,
Yeah.
they're after giving birth, these muscles are weaker, they're stretched out. Sometimes there's nerve damage, sometimes low estrogen if you're breastfeeding or lactating, and that can lead to some urinary leakage.
Hmm.
I always tell women if at 3 months postpartum you're still leaking urine, whether it's a cough, sneeze, laugh, or jump, or urge to pee, you should get therapy, pelvic floor therapy, because at
Hmm.
1 year you're likely still going to be experiencing that. So we
Interesting.
can't
Okay.
just say like give it more time, because again, it doesn't get better with time. Now, every person has a pelvic floor. So
Hmm.
in male bodies, what we see a lot of prostate issues or sometimes pelvic floor muscle tension,
Mm.
where they're not emptying their bladders completely. They may not be able to start their streams well. After a prostate procedure or surgery,
Mm.
the sphincter can get damaged or weakened, and that can lead to incontinence in men. We see a lot of older men with that.
Okay.
And then even in children, if kids are constipated, they can become bedwetters or leak urine. Female athletes who run, jump, have high impact exercise and load, they can have urinary leakage. So this can affect people at any stage of life. It's not just postpartum. And so I'm so passionate about educating women younger. So I'm like, hey, if you're experiencing this, go get help now, because again, I want you to keep playing your sport. I want you to keep traveling. I want you to keep having intimate relationships. We don't want these pelvic floor muscles to impact your quality of life.
I was going to ask this at the end, but I think it actually fits well here. Where can women find, or girls or men find pelvic floor specialists in their area? Is there like a resource or a website?
Yeah, there's a couple of websites. So one is called pelvicrehab.com, where you can list yourself as a therapist. Another one, Origin, is kind of a national chain of pelvic physical therapy clinics, and they have in-person care in some states, and they also have telehealth, because a lot of
Oh,
places don't have pelvic floor therapists. You can do a telehealth session.
okay.
And then there's another organization called the APTA, Academy of Pelvic Health, and they have a PT locator as well. But sometimes it's honestly doing a Google search in your area and
Yeah.
saying pelvic floor PT near me, asking your mom friends or your girlfriends, hey, have you heard of a good pelvic floor therapist in the area? Because word of mouth is really the best referral.
And it's so good to share that it's also covered by insurance, which some people might not know that. And that's a big thing.
It is. I mean, it falls under physical therapy care, just like any other type of physical therapy. Like I'm going to physical therapy for my hand because I fell, and that's covered under my insurance. So is pelvic floor therapy if that clinic takes insurance. Some clinics are what we call out of network or private pay. So
Yeah,
they're like a cash pay clinic where you just pay a flat fee and it doesn't run through insurance. So there's a lot of different options. And again, there's like, I have an app called the VHive that some people can
yes.
do at home, which I love.
So
It just
excited
makes
about
it
that.
so accessible, but you can do telehealth. We have a telehealth therapist on our team as well.
There it is.
Yay, there
Yes, I have her
it
app.
is.
Plugging.
I know, thank you. And then MenoLabs folks, we have a special code for you
Yes,
later to
yes.
access it for free. But it's there's so many different avenues to access care because you can't always even leave work to go get somebody to
That's
go
so
see
true.
somebody, or you may be not ready for that either.
Yeah, yeah. We've all heard about Kegels, but they're not the only solution. So, what else helps support pelvic floor health?
So Kegels are pelvic floor muscle contractions. So this muscle here, it's like you're closing the sphincters and lifting the muscle up. It's like a squeeze and a lift. If you're sitting at home, think about like sitting up tall. Take a
Yes.
deep breath in just to kind of help your body relax. And on your next breath, I want you to think about lifting your pelvic floor up. So almost like sucking up a smoothie with your vagina. So it's an inhale and exhale, contract. Sip up the smoothie with your vag. And that's like the movement you want to be thinking about. It's a lift, not just a tighten. Now, Kegels are a great exercise if you can contract but also relax. You can't just hold the muscle tight all day.
Mhm.
That's not how you strengthen a bicep. That's not how you strengthen your pelvic floor either. But you also need to bring this exercise into different activities like weightlifting or lifting or strength training and Pilates or bar, any workout that you do, you need to engage that pelvic floor as you load it.
Yeah.
But many people actually have tension, and doing Kegel contractions
Mhm.
or pelvic floor contractions could make their problem worse.
It's
So the
true.
first step is really knowing, and this is what we do in the app is we give you a quiz to kind of help you figure out, do I need strengthening or do I need relaxation? Because that's the biggest key is so many women have tension they need to release first before doing any strengthening.
That's me. I found that out. I went to a pelvic floor specialist and learned that. And I was so alarmed. I was like, oh my gosh, I didn't realize I was holding my stomach so tight. So, yeah, you learn a
Yeah.
lot about yourself.
You do. I mean, but we've been told like suck in, belly button
That's
to
true.
spine, hold everything tight. And, it's like nobody taught us that you also have to relax and release those muscles.
It's so true. So I have to work on the reverse. You share so many great hacks on social. Can you share a few with our community? I was thinking around the constipation hack, tampon hack, or any others that you had.
There's so many. And one
Yeah.
of the most common questions I get is like, what can people start doing to take care of their pelvic floor right now?
Mm-hmm.
So the first one is my pooping trick. So if you are at home, I recommend everybody get what we call a pooping stool.
Yes.
So it's a stool that you can use a toddler stool. There's a name brand one called the Squatty Potty. You
Yes.
can use a box. It doesn't matter what it is, but you put it underneath your feet when you're having a bowel movement.
Mhm.
So if you do that, your knees get higher than your hips when you're sitting on the toilet, and it puts you in a squatting position. And squatting helps relax your pelvic floor muscles so you don't have to strain during a bowel movement. So you put your feet up, you lean forward, your knees are high, and then you exhale like you're blowing out a bunch of birthday candles when you're pooping. So it looks like this. And because when you hold your breath, it actually can tighten your muscles instead of
Oh,
relax
yeah.
them. So that's the first one is knees up, lean forward, exhale.
I love
And I
that.
teach my kids that. And so it's like they know, they're like, where's the stool? Oh, every
Yeah.
bathroom in my house has one.
Ours too.
And so I love that. It's
Yeah.
so for the tampon trick, what this refers to is that if someone has bladder leakage, which can be common again postpartum with aging and perimenopause and menopause, I tell them to insert a tampon into the vagina. And what that does is it supports the wall of the bladder. So your bladder kind of sits right in front of your vagina. So if you put a tampon in, it's like the bladder can't move as much when you're running or jumping, or even if you like have a coughing attack because you're
Mhm.
sick, or a sneezing attack during allergy season. It just supports that tissue so that you don't have as much movement and leakage. And it's just a great way to prevent leakage while you're still working on your strengthening. So you can use a tampon. There's some over-the-counter bladder supports as well that you can get on, online or at your doctor. But I think it's just, I want women to know that there are things they can do to help still manage their symptoms, but still be active and live full lives.
I love that as an option. Now, I'm just curious, with urine, do you need to remove it more frequently?
No,
Okay.
no. So you can only leave a tampon in for 8 hours,
Yeah.
but it's in the vagina and not in the urethra. So because it's in
Yeah.
the vagina, it just supports it well, and you can still pee normally.
Okay, good to know. Interesting. We're all about tracking symptoms at MenoLabs. Can you share what a bladder diary is, and what women should be tracking? Because I love this.
Yeah. So if you have frequent urination, you like are peeing a lot at night before you go to bed or waking at night, if you have strong urges to pee, like when you hear running water or with a full bladder, or if you have leakage at all, or even like bladder pain or burning with urination, we have patients do what's called a bladder diary. And what that is it's 3 days, because research shows that looking at your consumption for 3 days can give you a kind of a clear picture. And you write down the time of day, what you eat or drink, and then when you pee and how often you're peeing or when you leak. And what it does is you can start seeing like, oh my gosh, when I have like coffee in the morning, I end up like leaking after that. Or
Mm-hmm.
if I, every time I have a glass of wine at night, I'm up 3 or 4 times at night having to pee. And it's not that you have to like take all of those things out. It just gives you awareness of what some of the triggers could be. So I'm like, okay, coffee's fine if you have access to a bathroom, but if you have a big meeting or you're going on a flight, you might want to have decaf. Or if you're going to a sporting event and you're going to be like standing in the stands and not have access to a bathroom, like maybe don't have beer. And so just giving people strategies to manage their urinary symptoms. And I mean, it's incredible. I had a teacher who had so much bladder discomfort, urgency, and she was drinking Mountain Dew all day. And when I was like, you got to cut out the Mountain Dew. And she's like, no. And I was like, if you
Just
want to
try.
fix your bladder problems, like, and then she'd end up holding her pelvic floor
Oh,
so tight that she couldn't pee when she finally went. She's like, I can't relax my muscles.
oh my
And
gosh.
so we just took out the Mountain Dew during the school week. And I was like, have it on the weekends when you're fine. And she was like, oh my God, this is so much better. I'm like, exactly. Like, it's just sometimes we need a reflection so that we can really understand what's going on.
It's wild how simple it can be sometimes, but it's so
Right.
empowering to do this tracking and just realize what the trigger is and then
Right.
evaluating how you can have it balanced. You don't do it at work and do it at home. I love that
It's true because I don't want to
strategy.
be so black and white of like, you can't do this, you can't do that. Cause I'm like, I'm
Yeah,
going to have coffee every day, you know? But if like, if I'm going to go for a run, I probably will have the coffee after my run versus before.
that shows you can still have your life and enjoy it. I
100%.
love that. I love that perspective. You've shared about having a tight pelvic floor on your socials. How should women be sitting during the day to keep this from happening? I'm like standing, sitting up better.
Me too. I'm like, unclench your cheeks, Sarah. You know, I always get asked, what's the best posture for your pelvic floor? And I
Yeah.
always say the next one because it's
Oh.
really movement that's key.
Hmm.
So if you are sitting at your desk for hours and hours on Zoom calls, and then sitting in traffic for hours, like getting your kids to and from school, then there's no blood flow going to this area. So I say like every hour change position. So
Ooh.
what if you're sitting, go to standing, or even just go for a walk to get water in the bathroom and then come back. If
Hmm.
you're crossing your legs on the left, switch and cross your legs on the right.
Yeah.
The best thing for your pelvic floor is to not be in a slouched position. So if you kind of, it's what I call sacral sitting. It's like if you just kind of are like this, rounded shoulders, tucked pelvis, you're almost like sitting right on your tailbone.
Hmm.
That's probably the worst for your pelvic floor. It puts a lot of pressure right on the tailbone and
I
kind of
feel
makes
that.
everything clench up. So
Hmm.
just like switch positions, don't sit with one leg crossed all the same way the whole time.
Yeah.
Move around during the day, and then don't do that sacral sitting that I see a lot of women do.
Great. Many women can experience late night bathroom trips. We talked about a little earlier. What should women do to help prevent this?
This is really common, and especially common during menopause
Hmm.
because your bladder, when you have lower estrogen levels, the kind of the pH level and the support of your bladder tissues changes. And so you'll find yourself having to pee all the time. So the first thing is I would decrease your fluids 2 hours before bed.
Yeah.
So and front load your fluids earlier in the day. So you still need to stay hydrated. I have a lot of women who are like, they'll stop drinking water because they're like, the more I drink, the more I pee. But you still need to get that hydration.
Mm-hmm.
Being dehydrated can actually cause your urine to be more concentrated, which puts you
Oh,
at risk for a urinary tract infection.
we don't want.
So, right, front load your fluids like earlier in the day, cut fluids off 2 hours before going to sleep. Um, and then what you drink makes a difference. So, really common dietary triggers for bladder urgency are like alcohol, wine, beer, cocktails, carbonated drinks, even sparkling water,
Sparkling
caffeine.
water.
Yeah, I know, which is like I love in the South. It's so hot down here. Um, but caffeinated drinks, teas, coffees, espresso martinis, right? And so like, and then citrus foods like tomato based
Oh, wow.
juices or products, grapefruit juice, orange juice, and then sugar and sugar substitutes, especially sugar substitutes. They're in so many foods. Those can be bladder irritants. So this is where that bladder diary kind of comes into play. If you
Mm-hmm.
just kind of track what you're doing, you're like, oh, I do have these like sugar-free cookies every night with like, a sparkling soda before bed. That just making some of these small changes can make a difference.
Definitely. Why do frequent bathroom trips mean that a woman may be in perimenopause?
The normal frequency to pee is every 2 to 4 hours. So if you're
Mhm.
going more frequently than that, you are not able to kind of hold your urine contents in as well. What happens is that your bladder needs to be able to expand as it fills, hold that urine, and then empty all the way. If you're going pee a lot, it may be your bladder is kind of shrunk a little bit. It doesn't have as much elasticity. Your pelvic floor may not be as strong due to weakness over time, and you can't hold in the bladder contents. And your estrogen levels change again. And so that means you have a more sensitive bladder lining. You don't have as much pelvic floor strength. So those are kind of signs of perimenopause. It's interesting. I have an older sister. I'm 43 and she's 4 years older than I am. And she's like, I'm waking at night to pee now. And it's like really annoying. And I was like, oh, well, that's because you're in perimenopause. And she was like, what? And I was like, yeah, that's a sign of perimenopause. We don't think about that.
Yeah,
Waking at night to pee, more frequent urination because your bladder health and urinary tract health are changing. And so that's really where I think people just don't know the signs and symptoms to look out for.
definitely. We talked about getting familiar with looking at your vulva earlier, but now I'd like to ask, why should women add moisturizing the labia to their
Yes.
routine? Another one that we might be not as comfortable thinking about.
So, as your estrogen levels decrease, the inside of the vagina and the vulva are all kind of have lots of estrogen receptors. And so, what that does is it helps build up collagen in the tissue. If you think about collagen in our face, it makes our face elastic and smooth.
Mhm.
And it also, estrogen helps lubricate your vagina,
Mhm.
um, keep it moist and keep it more flexible, right? Like if you're having intercourse, it's not going to be so tight.
Yeah.
So when you have low estrogen, it can lead to tight tissues, dryness, a lot of dryness, where it's like your labia sticking together, they're sticking to your
Mm.
underwear. It's itchy. It feels like you have an infection, but the infections are negative, and just discomfort with intercourse and dryness during intercourse, and that's all because of hormonal changes. And so moisturizing these tissues with a specific vulvar moisturizer, not just like your coconut oil off the shelf or Aquaphor or anything like that.
Mhm.
I love Aquaphor, I just not for this particular issue. But having a specific vulvar moisturizer is really important because it's going to help keep those tissues soft and moist,
Mhm.
less likely to be dry, cracked, and just like we put moisturizer on our face, we need to be doing the same thing for our vulvas.
Definitely. So it's a routine for us to all start, ladies. What are some interesting or surprising pelvic floor facts for women in perimenopause and menopause?
I think the biggest one is how early our pelvic floors start to change at the age of 35.
Your age of
That's when that
35.
like at the age of 35, 2% of our muscle strength is decreasing every year after that pelvic floor muscle strength. So that's I think one of the biggest ones that you can start being in perimenopause by your late 30s to early 40s. Like I feel like at 40, 41, I already started experiencing these changes, and
Mhm.
I'm just so glad I kind of knew what to do and what to start
Yeah.
to look out for. And that it's not just like urine leaks that could change. It could be painful intercourse. It could be more urinary tract infections.
Mm-hmm.
It could be, again, vulvar dryness, more frequent urinary leaks, more frequent going to the bathroom, constipation, hemorrhoids, fecal staining in the underwear. All of these are pelvic floor issues we don't really talk about,
Yeah.
but they're all related to hormonal and pelvic floor muscle changes. And that and I hate to say this, like it doesn't get better with time. Like we talked
Mm-hmm.
about the stats of 50% of women over the age of 65 are leaking urine. And, a urinary tract infection is a serious situation when you're older. Again, that it could lead to quality of life issues and even living changes when you end up, if you end up in a nursing home. And so I just say that so that we really know how important this is. And we talk so much about exercise and, how important that is, but it's a real limiting factor if somebody leaks or has pain when they're exercising. And we need to kind of talk about the real issues that are preventing someone from doing that.
And speaking of exercise, what kind of exercises would you recommend for the pelvic floor for someone starting off?
I mean, honestly, the first thing's walking, which is interesting. Like you're in
Interesting.
weight bearing, you've got pressure down on the muscles, you're contracting and, your muscles are kind of working. So that's one. The other one is building up hip strength. So squats, bridges, lunges. It's not just doing Kegels sitting in your carpool lane. There's a research study that shows that having better hip strength actually decreases urinary symptoms. So it's building up this whole muscle complex. And then the other one is obviously pelvic floor strengthening if there's a muscle weakness issue, but it's not just Kegels. It's quick contractions, it's endurance contractions, holding for 5 or 10 seconds and then relaxing all the way. Using this muscle before you lift, before you cough, before you sneeze when you're lifting weights, doing these exercises in different positions and during different exercises as well.
And if a woman does have pelvic floor concerns, incontinence, how can she be able to participate in doing these type of exercises? Can she do the lunges? Can she do the squats? I mean, I know you gave the tampon hack, but is that something you'd say she could try using, or are there other exercises they should do?
So the tampon hack is a great one. So leakage doesn't mean you have to stop working out. It just
Yeah,
gives you information from your body that like, oh, these muscles aren't working the way I need them to. And it's actually even more of a reason to you to focus on some of these like squats and lunges. I would start doing body weight work
body weight. Yeah,
first
yeah.
and then add in some resistance weights like resistance bands or hand weights or doing that strength training after that, after you build up just the balance and flexibility. The other thing I like doing is doing these exercises when you're not wearing shoes.
Oh,
So yeah, it's so much better for your balance. And so if you can work out at home and not wear shoes, it's like you work these small little muscles in your feet and your ankles and even your hips and your deep core muscles. And that is a great way to kind of build up more internal strength. But you don't have to not do something because you're leaking. You can wear a pad, you can use the internal support, or you can just stop before the leakage occurs. Like, say you can do 10 jumping jacks, but then by 11 you're leaking. Like, just do what you can before those symptoms onset.
great, great. Weighted vests are very popular right now. So I also wanted to ask if this is something that you would recommend for someone who has pelvic floor concerns.
It depends. If you are known to have prolapse or pelvic floor weakness, I don't necessarily think that the weighted vest is going to be what helps your pelvic floor issue. If you are going to use it, use a lightweight one. So sometimes they're like 10% of your body weight. That could be 12 pounds for me, which is a lot. So I would much rather start with a 6 pound one, have really good posture, have a little bit more endurance. So start with a lighter weight one, but it's not going to fix your pelvic floor issues. And if it causes leakage, pain, pressure, or heaviness, then I would probably take it off and work on building up your pelvic floor strength first. If you have tension, it's not going to necessarily cause any issues, but I always say anytime you do something strengthening, you need to do something relaxing afterwards,
Mm.
like yoga, some deep breathing, some really good hip stretches to release muscle tension after you've been tightening for so long.
I love that. I want to remind everyone that's with us, if you have any questions for Dr. Sara, please put them in the comment section so that we can get those addressed. Now it's time for the Peri Toolkit. We have a Peri Toolkit discussion at every show where we highlight items that can be added to every woman's Peri Toolkit. So I want to start with, what should every toilet room contain?
Obviously a pooping stool. So a pooping
Yes.
stool that goes underneath your feet. Double ply toilet paper, like single ply
I know, I
toilet
would love
paper
that.
should be like outlawed. Every time I go to a bath, I'm like, why are people using this? Like spend the 50 cents, get the better toilet paper.
I
Oh,
love
and then
that.
I also love a bidet. Like
Yes,
I'm
we do too.
I love a bidet for cleansing the area, for
Mhm.
preventing excessive wiping. If you're menstruating, it really helps you feel clean after a bowel
Yes.
movement, after your periods, everything. So I'm a huge fan of bidet. And you can get them online really inexpensively. I installed ours myself.
Pretty easy, right? Yeah. I'd love to plug your Hive app here. That is a great resource for women to use to help build a strong pelvic floor. And you're offering 3 months free to access the app using the promo code MenoLabs. But could you share a little more about the app?
It is amazing. We've gotten such good feedback. And I just had someone email me yesterday, was like, I'm so glad you created this. I was in pelvic floor therapy and then I stopped. And now this is really helping me keep my symptoms at bay. So it's, if you're having an issue at home, it's called the V Hive. You can get it on Apple devices or Android devices. You can go to my website, thevaginawhisper.com, and type in MenoLabs. It'll, that code is linked. It's forever available to access it for free for an extended period of time. And when you go on there, it gives you a quiz of like, what are your symptoms? What do you want to help with? And then we give you a roadmap of different workout programs to do. And it's as little as 10 minutes 3 times a week. Like, this is not an overhaul of your life. It's you're finding a way to work on these muscles that can really fit into your day. And it's strengthening, it's relaxation. So if you leak urine, have prolapse, and want to prevent perimenopause and menopausal issues, I have an entire perimenopause and menopause program that teaches you pelvic floor workouts with weight training and relaxation, and tons of videos about like sex and bladder health and post-surgical changes and hormonal stuff. So it's really everything I think you need to know about your pelvic floor, and it's like your pocket physical therapist at home.
So exciting. What tools or habits help keep the pelvic floor happy during perimenopause and menopause?
So we talked about some of them: not straining with bowel movements because that can weaken your pelvic floor, not pushing when you pee, just sitting and relaxing and let your bladder do the work. Pee when you have the urge to go. So try to avoid those just in case pees where you're going to have to find yourself going all the time. You should try to aim for that 2 to 4 hour mark.
Mhm.
Staying active. I mean, movement, exercise, all of that is really helpful to bring blood flow and strength to this area. And then I am a fan of a moisturizing balm in the area, like on the
Mhm.
vulva and vagina. It's non-hormonal. You can use it as much as you want. And it's just like I spend all of so many
Ah,
potions and
so
serums on
true.
my face, and just having a moisturizer for down there can really make such a huge difference for tissue health and dryness prevention and comfortable sex and all of these things. So really important.
Just a question to throw out there for anyone who doesn't already do this. It can't just be like your body lotion. It needs to be a specific
Yes.
product for
Yes.
your vulva vagina
Correct.
area.
You have a specific pH level of your vagina that needs to be maintained to help ward off infection. And that changes when your estrogen levels are lower. But anytime you introduce a new product, it's going to change that pH. So these specific moisturizing vulva balms are pH balancing versus like you can't use a lotion or a regular lotion for your skin on that area. It's totally different tissue and totally different needs that it has. So that's a great clarification to make.
Good to know, because there are different ways we're supposed to wash ourselves there. So I was just wanting to make sure we understood with
Yes.
adding moisture to ourselves. So
Yes.
same thing. I have a question from someone. I'd like to know about vagina dryness management at age 30 and younger, reoccurring by management.
I'm not sure what that last part means,
I know, I
but
didn't know that
yes,
part. Yeah.
there's is it okay for me to mention the name of the brands that I like for the
Yeah,
vulva
let's do
balms?
it. Because I'm
Okay.
curious too. I think it'd be great to know.
The favorite one I like is one called Medicine Mama. You can get it on their website. I have been an advisor for this company for years, and one of the reasons I like it is because if you look at the list of ingredients, it's like 4 or 5 ingredients, and you know all of them. So it's really like very clean. It's organic. It's organic. I mean, I use it on myself. I started using it postpartum actually when I was breastfeeding, because you have vaginal dryness then as well, and then you go into perimenopause and you still need it. So for vaginal dryness at any age, you need to make sure that you're staying hydrated. So your tissues are, you need to drink water.
Hmm.
Avoid using any harsh cleansers on the area. So you can just rinse this water with area. You do not need to be soaping it, scrubbing it. If you do use a wash, make sure it's a specific pH balancing vulva wash. You can't, it doesn't
Mm,
need to smell like coconuts or palm trees or spring. It just should just be a very clean, specific vulva
I love that.
wash.
Yeah.
And then using a specific vulva balm, and you can use it all throughout the day, every day. I tell people to put it on after the shower or before they go to bed, and it just is really hydrating to the tissues. There's also an internal suppositories you can take. Medicine Mama has these as well. There's other companies that have them, but it's like a suppository that goes into the vagina, and that can help moisturize the vaginal canal versus just the external balm.
Okay. Well, before I let you go, I want to highlight again that she has an exclusive promo to her app, the Beehive, which is going to be 3 months. It was 3 months, correct?
Yeah,
Okay, 3 months access to the app, and it's using the code oh no, not menopause. I was going to say menopause. Excuse me, MenoLabs.
MenoLabs.
I
Use
got
the
a little
code
confused there. I
MenoLabs
was
on
going to say
checkout.
menopause for some reason, but I also want to plug your book. I got your book
Ah,
after we did the rehearsal. I fell in love with all the information you shared. I was like, I just feel so empowered. And I was like, I
I
need to read
love
her
that.
book. So I want to highlight that you have a book as well. I want to encourage people to read this book. I want my daughters to read this book. They're both teenagers. And after I finish this, I'm going to have them read this as well. So I'm really excited about that. You have your website, you have all your socials. There's so much information out there, people. I hope that you'll go and check it out. If you have any questions that weren't answered today, I'd like to encourage you to reach out to our customer care team at customercare@menolabs.com. And if you're looking for support beyond today's chat, head to menolabs.com to explore products that can fit your unique menopause experience, because there's not one size fits all. And speaking of, we have an exclusive discount for all of you, 30% off using code VHIVE30. So that will go until Monday. And I want to thank you, Dr. Sara. This is so, so good. I'm so pumped about my pelvic floor.
Yay! Me
And I want to
too.
thank everyone for joining us. As always, this session should not be considered medical advice. It is being provided for information purposes only. It is not intended to substitute professional medical advice, diagnosis, or treatment. Please consult with your healthcare provider should you have any questions or concerns. Thank you again. Happy spring, first day of spring. Enjoy the beautiful weekend. And thank you
Thank
again,
you.
Dr. Sara. This was amazing.
Thank you, everyone, for tuning in. And thank you so much for having me. It was so great.
Thank you.
Bye,
Bye.
everyone.